Coffee with Marci. My mission is to bring entrepreneurs and nonprofits a voice, and I am live here at Apex Orthopedic with Tom Willmann. Welcome.
Thank you. Thanks for coming down to our little home here in Providence, New Jersey.
It's awesome. I really like your place. I mean, physical therapy. Yeah, physical therapy.
Yeah,
what am I talking about?
Rehabilitation. Yep.
Exactly. Sorry about that.
Yeah.
Oh, so anyway, how did you become a physical therapist?
Well, it's interesting. You know, I went to school undergrad, BA in psychology, and I really wanted to get into counseling. And I did. For a couple of years after I graduated, I was over at a community mental health center in Hackensack, and I worked as a counselor for a couple of years. And I said, gosh, this is definitely where I want to be. I want to be working with people and helping people. But I needed to just change my focus just a little bit. So at the time, a friend of mine was volunteering, and she was trying to make a change in career. And she was over at the physical therapy department at Pascagoula Valley Hospital. Yeah. And I still remember Linda Williams that ran the volunteers there. And she was telling me about her experience. I said, gosh, that kind of combines my active lifestyle. I enjoy being active and also working with people, you know, seeing people move a little bit better. It was just fit me more. It matched my kind of needs and my passion. Yeah. So I went back to school for some prerequisites. I took my anatomy and physiologies. We sat for the graduate record exam, the GRE, and before I knew it, I was at the University of Miami at PT school, and just
it's amazing, right?
Really, it was so easy once you knew what you wanted.
Yeah, absolutely.
So it
unfolded for you, and you found your passion, and now you're helping people, which is amazing.
Yeah, it's just been I'm so lucky. You hear some of the kids we work with, and they're like, I still don't have that match what I want, and I found it, and I was very excited about it, and I haven't looked back, you know. So that was so I graduated in like late '97. And then 98 to 2001, I worked for a local clinic. Got some good experience, made some mistakes, learned a little bit, and then I went on my own for another 3 years with an ex-business partner. And we opened this place in 2004. I said, I want to do it on my own. Let's go out and
That's
do it.
Great.
You know,
yeah, absolutely.
That's kind of how we started here. And it was a little stressful time, you know, and the time, I don't know if we talked about this a little earlier. So my wife was pregnant with our oldest, Ryan. We were down in Barbados. This was our last vacation for a while since we were starting the business. We were moving from Brooklyn to Tenafly, and I went up on a wave and I landed on my shoulder, and I couldn't move my arm for 5 days. I couldn't comb my hair. My wife's got a poker face. She looked at me, she goes, "You'll be fine." And it all worked out. It all transitioned. We were able to kind of get back. I rehabbed myself, and things transitioned, and the business grew. And a few years later, we're here.
That's great.
So it's been a wonderful ride, as they say, you know. So, but yeah, that's kind of the origins of it and how we started.
That's great. So I love to hear the background and who you are and how you got to where you are. So let's talk about Apex now.
Well, Apex, you know, my vision of Apex was kind of, you know, why when I was growing up in Oriole, is that family feel. You know, the feel that everyone here felt like being taken care of, a little more special. You know, as soon as you walked in the door, as soon as you called, you know, Kathy, who's not here today, you know, she has a warm sense, you know, how are you doing? Tell me why you're coming here. You know, how can we help you? And really understanding their problems, and just like, you know, you talk to your mom or your dad about it, and that really continues through myself and through Franklin and the other aides here. We try and create that family and very team focused. We want to, you know, just have a good time, but also get results. You know, and have that kind of balance between the two.
Because it can be scary,
right?
Yeah. Like you come in, you don't really know what to expect, and to be greeted in a kind way and have the family feel, that's important. So I like to hear that.
Yeah, and you're here a long time too. You're spending a lot of visits here, hopefully less than more. You know, you want to make it a special place. We on St. Patty's Day, Kieran Doyle, he gave me his Irish soda beer recipe. We have it here, and we all have a little bite there on May. And you know, we try and celebrate that kind of passage of time, and as you get better. So it's pretty cool.
So the Apex experience.
Yeah, it's the overall experience. It's not just about, you know, the focus is getting you better. That's the first primary. But we also want you to enjoy yourself and enjoy your time here. And we really do have people come back all the time. They come up right off the off-ramp here. They say, let me stop by. And it's really kind of cool to have people come back and say, I really miss you guys. And, you know, so that's the kind of experience we want. And that's what we try and create, and it's been wonderful. It's a great place to work because I want to be in a pleasant place, and create that feel, and that's really occurred. So
that's wonderful.
Yeah, so
I just want to see here really quick. Oh, hello, Michael. How are you? Let's see. Okay, great. So someone shared the video. Wonderful. I just saw some things going on here. And Michael just shared the video. Thank you so much, Michael.
Thanks, Michael.
And that's awesome. So So we were talking about the Apex experience, and let's talk about when do you know you need a physical therapist?
It's a good question. You know, there's different places that physical therapists can be found. They can be in pediatric for young kids that might have problems turning or walking or crawling. You can see therapy. We actually have a therapist that just started here, Tracy Doyle, in pediatric physical therapy. That's her specialty.
Yeah.
You have other people that may have lower back pain, weakness down their leg, arm pain, difficulties moving their head, checking their blind spot,
Right.
you know, things like that. And it feels like it's musculoskeletal. It might be painful. What is this?
Right.
Maybe is it something related to that needs to be stretched or strengthened, or is it something related to something else? So
Yeah.
we talked earlier a little bit about like, what's the time that we know that we should go see a doctor quickly. Let's say we treat a lot of lower back pain and sciatica.
Right.
So
Right.
when do you say that this lower back pain is something I should be worried about? Or we talk about red flags, and one of the red flags is if you have horrible, like serious night pain, that may be a sign of a systemic problem, a cancer or a tumor or something. And night pain is a classic thing. We when we hear that, we get a little more concerned.
It's so interesting how the body is always trying to tell us if
I know.
something's going on.
Let's
Listen
take care of it.
to it, right?
Listen to it. Wake up. Don't worry about the next activity.
Exactly.
One of the other things is really what's called progressive weakness, which means not just like you're weak because you didn't work out. All of a sudden you can't lift your arm, or your handwriting is getting funny, or you can't type. That might be a sign there's something more significant. And you really want to see a doctor really quickly about that. You don't want to just disregard that. Because sometimes when you get weak, that weakness doesn't come back if you don't address it quickly. So that's one of the big things. Another thing is bowel and bladder changes, like all of a sudden immediate changes. I'm not just talking about one day, we're talking about a sudden change. And you really want to go to the ER and get that looked at. That can be a sign of a very serious condition.
Wow.
Those are some of the things you want to really look at and say, I'm not going to see Tom. I'm not going to even talk to him. I'm going to get the ER. I'll go to my doctor within 24 hours. You really want to check that out. But there's very serious or painful conditions with lower back pain, sciatica, that you can come to a therapist, and we treat all the people with tons of leg pain, arm pain. And if we feel after your screen it's not appropriate, we say, what, I know you thought this was something that wasn't serious. Let's send you to the doctor, or, whoa, this is something we can help you with.
Okay.
So red flags are a big thing that you want to look for and be mindful of.
Yeah.
Don't disregard it.
So sciatica, that's also big in pregnant women. Can you help them?
Yeah, depending on the type of, we take them through a particular evaluation, and based on the evaluation, we can tell them whether they can help them. Some people we can. Certain positions with pregnant women we can't take them into.
Right.
I would say that's one of the areas. There's special therapists. I always like to say I stay in my niche. With people that are pregnant, I really defer to them, to people that have women's health and more involved with the pelvic issues. I can look at them, but I really feel more comfortable with some of the therapists that have specialized in that area, women's health. So I typically will, if they've had their pregnancy and their delivery, then maybe after that I'll see them. But I typically like to defer to those therapists because they really know how to work with them. We don't want anything to happen with that.
Of course.
Yes.
Thank you.
Yeah, thank you. Yeah. But we see a lot of lower back pain and sciatica. We treat a lot of that type of condition, difficulty, weakness, even balance problems related to lower back pain and sciatica. And it's a scary condition. You just say.
Does that just happen, or is that like from working out or getting old, or what is it?
It can be the drive. It could be. You know what the biggest thing is? Sitting. Sitting. There's a new smoking. Sitting, I'll tell people, they'll say, well, I came back from the shore. It was a 3-hour drive, and that's when it happened. I didn't do anything particular, but that's when it happened. So sitting is a big trigger for a lot of lower back conditions. All of a sudden you're working extra hours, you're doing an 8 to 8, and you're sitting longer, and that actually one of the big factors. And there's certain people that are risk factors, like smokers are at greater risk. People that are overweight, there's certain things that are at your risk factor. But a lot of people, do you lift with anything heavy? No, I just sat longer. I was in traffic, the Jersey Shore, and that was the point. I got out of the car and boom, it was going down my leg, and that's when it started.
So the pain goes down your leg.
Sciatica typically will go down your leg, back your leg, sometimes into your foot.
Okay.
A good sign if it's improving is it's starting to move up. Like if you say, I don't want to see Tom, or it'll start kind of moving up. That's a better sign. And it can take 2 or 3 months. Sometimes it's going to resolve on their own. Okay. But with some early intervention, the exercises oftentimes can kind of make it go a little quicker and help you out.
Right.
So that's where we come in. And in a few cases, don't get better unless you really have specific treatments. So.
That was one of the things I want to talk about. Knowing when you should come in and not put it off. Like, when you start feeling pain, a lot of people put it off. We're like, I don't have time to get into the doctor. Like, if you don't take care of it Like, what could that lead into?
You can lead into more weakness or symptoms that just don't change. They don't improve. If you have a disc herniation, and a disc is just a piece of material in your back, and it's leaning on a nerve, it's leaning on it too long, that weakness, let's say you start developing weakness, sometimes can't change if it's been there for a while.
Right.
So you do, if you can address it early, you decrease that chance of that nerve, not being irritated to the point where it won't come back. Where you have this weakness, you always develop this limp. I'm not saying everyone has that, but that's something that's a big concern. If you have the weakness and you let it go, that's a big concern. Or constant tingling, like, this tingling and numbness has not changed. That can be something that may be more permanent, and you really want to take care of it then.
Right, right.
But those are the big things I get concerned about. I'm really getting this weakness, I can't lift my arm as much. Whether it be, let's say, a neck issue. Yeah. You really kind of want to address it. And maybe, whatever, go to your doctor, look into it. Don't disregard it. Yeah. So I would say that's the big concern that I have. So,
well, great. Yeah. So that's good to hear.
Yes.
So listen to your body and take care of it.
Absolutely. But work out. I like to hear, the working out is great. Sometimes it triggers lower back pain. Yeah. But, not necessarily the only reason why,
So, going back to working out. So, CrossFit, for instance.
Right.
That's a big one.
Yep.
Getting yourself prepared or hurting yourself. Like, I've done stuff, kind of a CrossFit, and hurt myself. So can you talk about that?
Yeah, it's funny. CrossFit is really debatable. Like, some therapists hate CrossFit, some therapists. But I think there's certain specific things. If you have a good CrossFit trainer that modifies for your particular condition, someone that kind of talks to you and says, where have you had trouble? Where are your risk areas? What type of problems? Someone that's got almost a little post-rehab experience. That has been really valuable, because I've seen some guys that have really screened people and looked at them. But I think the body is very adaptable. I think there's a lot of movements. If you go through the right progression, you can do. I'm not one to say, you got to stay away from everything. There's certain things that are a little higher risk, which you have to be a little careful about. Certain types of sit-ups and curl-ups, you have to be a little careful, because they're one of the triggers for disc herniations. They're the ones. If you have a herniation, you've got to be very careful with that. That can really be a trigger. So you want to be a little careful about repetitive flexion in certain loaded positions. I've seen people in here that have had that. I like to look at a balance workout, that's kind of, we're working on some flexion, we're working on some extension, we're balancing a workout. And sometimes you just, whatever workout, you just happen not to balance it. But CrossFit is definitely, I know what I love about it, it's the variety, intensity, but also there's always a higher risk with that, higher intensity, but higher reward sometimes too.
Exactly.
So you got to balance the boot camps, classes, and all that. I like that variety of movements. The hardest thing is guiding someone, because every class is different. I'm like, that's the hardest thing.
It is. Everything is different. And I just started Pilates, which is really awesome. I'm enjoying that too.
I love Pilates.
Yeah.
It's all about alignment.
Exactly.
My wife does Pilates. She loves it. Yeah. And I don't have to massage her neck as much or help her out with that. She says it just helps her alignment. She feels taller. And I like the whole core and focus. It's a great, you got to tell me about it when you get that and all that. Yeah, absolutely. Great. That in yoga, in alignment. Pilates I particularly like, but I wish I loved that.
That's thank you.
Yeah.
So, herniated discs. Let's talk about that a little bit.
Herniated discs, interesting. A lot of people, give you an example, have herniated discs on MRIs. And they did research on people, won't bore you too much with research, that have herniations have no symptoms in the back. They have no lower back pain or sciatica.
Interesting.
So a lot of times people say, I got this MRI, they'll come to me, and obviously nervous, a little apprehensive. They'll say, I've got this herniation on my MRI. And I'm nervous about it. And I said, there's a lot of people, 30, 50%, even higher sometimes, that have these herniations. Sometimes, funny, I'll have a patient that'll come in and they'll say, I got a herniation on the right side, it's hitting the right nerve. I'm like, but why are your symptoms on the left leg? Yeah. So sometimes it doesn't match up. So you do have to take the MRI and pair it with how the person moves, and how they move sometimes match. Like, yeah, right, that herniation seems to be where your weakness is, where your tingling is. And then it means more. But it's really, the MRI is part of the whole picture. Because a lot of people, even say rotator cuff tears.
Yes.
30, 40% over the age 50 have rotator cuff tears, partial tears. Do we treat them all? So you got to be a little careful about getting too apprehensive. In fact, they'll say, even with X-rays, they'll say they don't recommend doing an X-ray immediately upon having back pain. They say actually the outcomes are worse. They get more nervous about it. They've got this diagnosis, this image in their head, and their outcomes are worse. They get more nervous, more apprehensive. They don't move as much, and therefore they start sitting more. And then all of a sudden they're not as engaged in therapy, and it's actually not as good. So they say, don't even X-ray them just yet, unless you have those red flags. And those things you have to be very careful about.
Right.
So herniations are, we'll treat a lot of people with herniations here, but some people will say, you're responding. The herniation's still going to be there, but you may not have symptoms. once you get done with us, which is what you want.
Okay. So how about the evaluation?
Oh, okay.
Let's talk about that.
The evaluation. Oh, everyone hears about, there's one method, Marci didn't know about it. She goes, what's this McKenzie method? And our evaluation is a very systematic evaluation. We talk to you, say, what times do you have trouble? All the time. I have trouble when I sit, drive, when I get out of the car, I lift my leg out. That's my problems. You take a look at the history. And then you ask them, when does it bother you? When you're standing, walking, sitting, when you reach down to, tie your shoes. And then you take them through a bunch of movements. And you're going to see in standing, when they arch and they bend, wow, I get the pain more when I do that. Well, the pain goes away when I lean back. And you understand basically how the back how your pain acts. We want to understand how your back pain acts. And often what we want to find is one exercise that you're going to walk away from after your evaluation that's the one that we think is going to help you out. And we'll typically tell someone to do it 10 times every 2 hours. And over 2 or 3 days, we know if that movement is going to help you out. It may not take it away completely, but hopefully it's taking away the frequency of it occurring, how long it lasts in the car, and how intense is it. So those are some of the parts of the McKenzie evaluation. It's a very systematic approach. And you can see people that are fast responders, slow responders, and non-responders.
Okay.
And if someone's, within 2 or 3 visits, I may say, this isn't for you. You've got to go back to your orthopedist. You got to choose another approach. And that's the beauty of it. It's a system. You learn from it, and it's very simple. The power of one exercise when you leave. Yeah. And if it doesn't work, it's not working because of that one. So that's why I love this system.
Yeah.
So it's kind of cool. It's a
great.
But you'll see, and if you ever want to get a McKenzie practitioner, let's say you're out of the area, you can go online. We can put a link in there, and you can find one if you're in Arkansas or whatever. But someone that's certified that really knows the system, and it's pretty amazing the results. I mean, early on when I was first coming out and I was a new therapist, I kind of had an eclectic approach. I did a little this. I did what course did I take recently, and this one has kind of narrowed it, and I'm kind of got my niche, and that's kind of what we do here is really a niche. A lot of spine, a lot of this particular approach, and we're really good at it because we do a lot of it. So that's kind of one.
So is this a new approach, or
no? It's. I mean, Robin McKenzie was the founder of it. He started treating in the 1950s from New Zealand. And he's kind of refined the approach over the years, and it's changed even the last 5 or 10 years.
Right, because things are changing all the time, right? So they're finding things that are working better.
Yeah, and even how our approach. Well, we got to change that. Yeah. So it's it's kind of a interesting story how he started, and it's pretty cool. It's pretty cool. He's a really dynamic guy. Just passed away a few years ago. He was teaching, instructing until his 80s.
Wow.
So he was really learning at that point. So, but yeah,
isn't it a great way? Let's keep on learning.
Keep on learning every day. Every day. Yeah.
So you have pediatric physical therapy.
Yeah, we have a new therapist here. She's actually an old friend. She used to be here doing orthopedics. Now she's focused, as we talked about, focus in pediatric physical therapy.
Yeah, that's great.
And that's if you just had a baby boy or whatever, and he's having trouble rolling or crawling, or they haven't reached certain developmental milestones. Sometimes a referral to a pediatric physical therapist is a great way to kind of get an assessment from them, in addition to your pediatrician. And we had it for our son for certain things we were concerned about as far as crawling and how he moves, and he received some help from Tracy actually way back. That's long we've known Tracy, my 7-year-old. Wow. And just different milestones, why he's not turning his head a certain way. And that's a specific area, that's a real niche, and you want someone that just does a lot of that. And Tracy's really decided to take that focus, so we're excited to have her here. She's really great. We're going to have her do a few little informationals on YouTube about when you should be concerned about if your child isn't crawling or speaking or doing different things, more physical, obviously.
Yeah, more physical.
So that's one of the things a pediatric physical therapist does.
What ages do you work with?
They work as early as 3 months. I think even earlier, upwards of 6 years. She'll work with patients depending on the level they're at.
And how about you? You work with young athletes?
I work with young athletes more for spinal type problems. We will work with some people with joint issues, but our main issue is spinal. I would say 10 to upwards of 70 or 80 of the aging athlete, and I'm an aging athlete too. So, but yeah, we work through that range. Yeah, keep moving. But I always say try and keep it active, and whatever age you're at, we just want to make you a little bit better. I can't go back to 20. I understand that, but get a little bit better. But yeah, that's our main thing is that for spine, a lot of spine within those age groups are one of our prime focuses here. So so excited. But I'm excited to have Tracy on as the pediatric end.
Yeah.
She's got a lot of that team feeling too. She carries
Good.
that tradition. So
Good,
it's
wonderful.
cool. Yeah.
Well, you wouldn't bring her on if she didn't.
No, we couldn't have her here. She couldn't have her. Don't learn how to make Irish soda bread. That's her husband's recipe. So,
Oh, God.
Yeah.
So you were talking about videos, so that brings me to Apex TV.
I was in, we're in similar paths here. I do this show. It's on my 4th episode, and we're interviewing local healthcare practitioners on various topics.
Okay.
We have David Miller from Miller's Pharmacy is going to do an interview with us.
Yeah.
And we're going to talk about anti-inflammatories, pain medication, the whole concern about the opiate epidemic, and kind of understanding maybe his view on it, different options as far as anti-inflammatory therapies, whether it be Advils or Motrins or prescription-based, and just his view on medication. We hope it kind of brings some value to whatever discussion or interview we have. We had a massage therapist talking about reflexology and different massage techniques, personal trainers, ways to train, the concerns we have with types of training. So that's kind of the goal of Apex TV. Is
I love it.
And a little value, like you are with entrepreneurs, we're trying to give them with wellness.
I love that. And everyone's looking for more information on that. And the opioids, oh my goodness.
I know.
So sad, right?
It's so sad. You hear so many people.
Exactly.
And you kind of get down that path. It's a sad thing.
And you can help, though, you can help take that pain away without taking more pills.
Well, that's the thing. Yeah, our big thing is trying to avoid or minimize the use of anti-inflammatories, unnecessary injections, and surgery. I mean, some of the surgery out there, like the spinal fusions, the success rates are so poor on it, and you just don't want to jump to it. If you have to, sometimes there's a moment.
Yeah.
But if we can kind of push that off, or try and get you enough comfort so you can say, you know what, I don't need surgery anymore.
Yeah.
That's really the goal. But you can, even for pain of that severity, you can.
Wow.
It's not a guarantee for everyone. Like I'm a
but it's great to hear that you could possibly heal it without surgery.
And that's the goal, is to try and do whatever you can, beg, borrow, and steal before you take that next step and do more invasive injections and things like that. And if you have to, you gotta. We don't judge here without that. But we want to give you, whatever you can prior to taking those steps.
Okay.
So, and I'll even say, I'll explore acupuncture, explore massage. Do what you can that's not going to actually hurt you, and maybe progress it along or help you along. Within a year, a lot of things change, but getting to that year after an injury is very hard.
Yeah, I would think so.
It takes, how do you, hold it together, not rely on the pain meds and things like that. So
that's got to be really hard to have that inner drive to continue that,
Yeah, you're thinking like,
because
I just want this to turn off.
You turn off, you might give up. It's just like debilitating.
Yeah.
So.
It takes away from you enjoy Pilates. All of a sudden you can't do your Pilates.
I know.
I mean, and exercise for me is a big stress reducer.
And it creates, then you get depression. Like there's so many things that, Yeah,
it's like, was it depression before the injury or after injury? And you're trying to work them through, and they're kind of depressed, so they don't want to exercise. They don't want to remain active. And you're trying to get them to that next point, and it's
great
tough.
that you can help with that, though.
Yeah, it's
incredible.
I still love it.
Yeah.
I still love it. I remember seeing my first patient when I was in clinic and using this particular McKenzie approach and seeing a rapid change in one treatment.
Oh, wow.
It doesn't always happen. Always when it does.
Yeah.
And you're like, wow, that felt great. And it still does feel great when you see that change and someone improving, and it's pretty cool. So,
Now you were going to show some exercises.
All right, we have.
So let's talk about that, and then show me.
Yep, absolutely. We'll go through our top 3 exercises for lower back pain and sciatica. Obviously, we're going to explain one of the precautions with it. So we're going to show you 3. We're going to move the camera over. Marci's going to move it over here. And the big thing is that the condition shouldn't be made worse. So if you have pain and it's getting worse, and we're going to explain what's worse too, we want you to stop and talk to a doctor and don't do it. But this is an exercise that should change your pain and make it less intense and less frequent and move it. But let's go over here into the clinic.
All right, take a look at the clinic and see these exercises.
All right, so. Okay, so if I had an order of exercise that I think that probably the top 3, and it's actually on my YouTube channel too about this. The first one is a standing lumbar extension. Okay, so you're going to basically take your hands on your hips like this. Keep your legs a little wider, not a narrow stance. You're going to let your hips go forward.
Can we see?
And lower back, go back. Yep, you can see it. All the way back like that until you feel pressure at the end, and then back into standing. You're going to do it a series of 10 times, repeatedly back and forth. You got to get to the end, like you got to get to the point where you can't go any further, and then stop. That's the standing lumbar extension. Now, just so you know the precautions with all these exercises, let's say you come to me and you've got buttock pain and a little bit of thigh pain. I got that sciatica coming again. If you're doing the exercise and once you stop, the pain starts running further away from your back into your leg, bad sign. Stop the exercise. If the pain's moving out of your thigh and actually into your butt, maybe, wow, now it's not in my thigh anymore, Tom. It's up here that's a good sign. And sometimes it actually feels worse when it moves up, but still keep on doing it. So it's 10 times every 2 hours. That's the standard. So those rules, as far as the pain moving, we got to be worried about. We have to watch, and we want to do 10 times every 2 hours. Okay. So the second one is a prone press up. Okay. So you're gonna lie on the table when you can. This is harder because people can't just throw themselves on the office floor. So this is when the standing one works. We're really happy about it. So you're gonna stand. You're gonna lie down like so. Place your hands right underneath your shoulders, like so. You're gonna press up like this. See, you get a little arch right to the point where you can't.
It's like
go.
Cobra.
Like Cobra, yeah. I love yoga here. I tell you. And then back down. You can do a series of 10 times, like that. Good. And you've just got to pay attention as you're doing the exercise that the pain isn't radiating down. So we have it in our buttock. We don't want it radiating down. Listen to those rules and you won't hurt yourself. Okay, the third one that you don't really see a lot about is a lateral shift, okay? So most times it's with people that have pain just on one side, or sciatica. It's just on one side, you don't have anything on the right. Typically it's the painful side away. Place the hand out, keep their elbow straight. Place your hand at your hip, and you're going to press your hips here like that. So pressure on, pressure off. 10 times. Pressure on, pressure off. Where's the pain? Is it moving up? Good sign. Moving down? Bad sign. Okay? 10 times every 2 hours. After 2 or 3 days of doing this, if you don't have a change in your intensity of the pain, where it's located, frequency, how long it occurs, intensity, then you got to stop. May not be the right exercise because you really need a formal evaluation to shore. But this is my shotgun. That's like if my uncle calls me from Texas and he has low back pain. I tell him just what I told you, and hopefully that helps you out. But just listen to precautions, and obviously this is not a formal evaluation. So I hope that helps you out, Marci.
All right.
Your
Thank you so much for joining Coffee with Marci. It's been great having you on. Very informative.
Thank you very much. Thanks for taking the time to come down here.
Absolutely. So if anybody is looking for a physical therapist, please reach out to Tom, Apex Orthopedic Rehabilitation. We'll put that information up.
Sounds good. And thank you so much. I'm excited. It's got me energized here. So
I
learned a little from Marci about interviewing, so I'm really excited too.
Well, I'm glad I could teach a little too.
Absolutely. Thank you so much.
All right. Thank you. Guys, have a great day. We'll see you soon.
Be well.